If you're a dental hygiene student struggling with head and neck anatomy, today we are continuing the arteries, specifically the anterior branch of the external carotid artery. So this has 4 branch groups, the first one being the anterior branches, and that has 3 branches, the superior thyroid, lingual, and facial artery. The superior thyroid artery is the first anterior branch. It supplies everything around the thyroid and the larynx and infrahyoid muscles. The infrahyoid supplies the infrahyoid muscles, the sternocleidomastoid, the SCM. That artery supplies the SCM muscle. Superior laryngeal, that artery supplies the muscles of the larynx. Cricothyroid, that artery supplies the thyroid gland. You can think of ice cream is not good for my vocal cords. Infrahyoid, ice cream. I know it's ice cream, but just go with it. Larynx is basically your vocal box. Just go with it. Okay, next your lingual artery. This one sits a little superior to the superior thyroid artery, and it's at level to the hyoid bone. So this supplies the tongue, deep dorsal and sublingual branches, the floor of the mouth, the suprahyoid muscles, and the sublingual salivary gland. If it's under the tongue or on the floor of the mouth, it's most likely coming from the lingual artery. The sublingual artery, which is one of the lingual artery's branches, it supplies the mylohyoid, sublingual gland, and mucosa of the mouth. The facial artery, this is the major anterior branch, and clinically it's very important. And so is this. It travels over the submandibular gland, around the inferior border of the mandible. It continues anteriorly and superiorly along the side of the nose and terminates at the medial canthus. So this has several branches, and it's grouped into cervical and facial categories. Cervical branches, ascending palatine. It's going to be the soft palate and palatine tonsils. Glandular supplies the submandibular gland. Submental supplies the mylohyoid, digastric, and submandibular lymph nodes. Facial branches, inferior labial, the lower lip, superior labial, upper lip. Angular is going to be side of your nares, or the side of your nose. The lateral, think about like how you gotta look up angular to make sure you don't have boogies in your nose. So far, so good, right? So those were your anterior branches. We have the superior thyroid artery, lingual artery, and facial artery. Superior thyroid artery has 4 small branches. Lingual only has 1 small branch, but basically supplies the whole floor of the mouth. Facial has about 6. And where does it terminate? Over the medial canthus of the eye. Okay, well I hope that helped. Have fun studying, and I'll see you in part 3 for the medial branches. Bye!